In this lecture, we will discuss fusion and capture beats, as well as how they would appear on the EKG. Fusion and capture beats are both helpful clues in making the diagnosis of ventricular tachycardia, or VTach, which is a regular wide complex tachycardia originating from within the ventricles. In fact, some would call these hallmarks of VTach and can be seen if you have a long enough rhythm strip. Okay, so just to review, VTach right here is a rhythm, a wide complex regular tachycardia originating from within the ventricles. Okay, and it's coming from our ventricles that are setting the rhythm of the pace. The reason we have a wide complex, okay, notice we have wide complex throughout our rhythm strip, is because it's coming from the ventricles outside our normal conduction system, so we're going to have slow cell-to-cell depolarization. Okay, so that's why we have those wide complexes here on the EKG. Okay, so notice how they're beyond their normal 70 to 110 milliseconds, okay, which is about 2 to 3 small boxes. All right. So let's take a look at both of these beats. We're going to start with the fusion beat. So occasionally a sinus or other supraventricular beat will occur at a point that allows for some innervation of the ventricles to occur through the normal ventricular conduction system. This results in a fusion beat, which is also known as a Dressler beat. So when the supraventricular and ventricular electrical impulses coincide, they produce a hybrid complex of intermediate morphology. That is, a complex that has the morphology somewhere between the abnormal ventricular beat, the wide complex one, and a normal QRS complex. Okay, so what we're getting here are these fusion beats, okay, or Dressler beats. And what we're saying here is that, again, imagine that we have some place in the ventricles that is acting as our ventricular origin, okay, so we'll use this area here, okay. So notice that we're in this whole rhythm strip represents VTach, okay. So we have this firing throughout here, and then all of a sudden, so we have these wide complexes, we have a impulse that's coming from somewhere above the ventricles. Let's say it's coming from our sinus node, okay? So the sinus node fires down through the AV node, okay, and is able to capture some of the ventricles. So it's actually able to make its way through and say it's able to depolarize some of this area, okay? But at the same time, you also have this beat coming from within the ventricles, okay, from our origin of this ectopic focus, and it depolarizes some of the other side of the ventricles. Now, because you have them coinciding together, you get what's called a fusion beat, okay, which is a hybrid of the two, of the normal and one of the ventricular origin. The normal one coming from a supraventricular area, okay, that's coming down and making its way through, and then the other one portion coming from the ectopic site in the ventricles. Okay, so that's what we call a fusion beat, where we have a sinus or some supraventricular beat that's coinciding with the ventricular beat, so we get this. Now, just so this is clear, this indicates that there are two foci of pacemaker cells. We can have the sinus node or some other supraventricular pacemaker, as well as the ventricular pacer. They are firing and stimulating two areas of the ventricle simultaneously, and thus this results in that hybrid or fusion of the two complexes. Okay, so again, one comes down our normal conduction system and one is coming from outside, so you get a fusion of the two. Okay, so imagine this is, let's say this is a normal beat, this is our regular beat from a ventricular origin. The fusion is kind of a mix of the two, hence its name, fusion beat. Okay. Next we have the capture beat. A capture beat is completely innervated by the sinus beat, okay, or some other supraventricular area, and is indistinguishable from the patient's normal complex. In other words, it is a ventricular complex of normal duration that results from some supraventricular source that fires at just the right time that it quote unquote captures the ventricles in the setting of AV dissociation. So you may be wondering, why not just call this a normal beat then? Well, it's because the normal complex again is occurring in the middle of VTach. It is caused by chance timing of a sinus beat that occurs at just the right time to capture and transmit down the heart's normal conduction system through the AV node and to depolarize the ventricles. In other words, there is a return of atrial control over the ventricular contraction following a period of AV dissociation. So again, let's just erase this here so we know what's going on. So we're again talking in VTach, okay? These are both occurring with ventricular tachycardia. Remember, the one that's dominating the source is coming from the ventricles. They were saying it's this area here. Now let's just say it for some reason, okay, we have the sinus node or some supraventricular source that's able to just fire at just the right time and make its way through to the ventricles and depolarize them, okay? So it's a transient capture, okay, of the ventricles during AV dissociation. So it fires just at the right time to go through our normal conduction system. And because it's going through our normal conduction system, we have a normal QRS that has normal duration, okay? And this is what we call this capture beat. Notice a normal QRS and normal duration, okay? You can actually see there's a P wave, QRS, and a T wave. So everything is occurring normal there, okay? The reason we don't call it a normal beat is, again, because it's occurring during VTach. So if you see fusion and or capture beats with a wide complex tachycardic rhythm, you've likely made the diagnosis of ventricular tachycardia. All right, let's briefly review what we discussed before we end. So again, both fusion and capture beats are going to help us with making this diagnosis of VTach. We said the fusion or Dressler beat results when a sinus or supraventricular beat coincides with a ventricular beat. And because they're occurring at the same time, right, we have one coming down our normal conduction pathway and one originating outside it at that ectopic ventricular focus, we get this hybrid beat, okay? And that was this hybrid beat that we saw here, fusion beat. Then we had the capture beat, in which the sinus node or some supraventricular source is able to transiently capture the ventricles through our normal conduction system, and therefore we get this normal QRS of normal duration. Well, that's the end of this lecture. We discussed fusion and capture beats, as well as how they would appear on the EKG. I hope you learned something.